What to expect from stem cell therapy for sciatica relief. Hi, I'm Josh here at Dream Body Clinic, and fixing lower backs is probably the second most common thing we treat here after knees. It seems like everybody's knees or lower back eventually goes out at some point, and fortunately we have an amazing protocol that we've been doing for over 8 years that works incredibly well for this. So we do 4 shots at 25 million into the lower back, plus an IV of 100 million. Now what you hear is some clinics are actually going into the disc, and you would think that that would be the right way to go. In fact, we thought the same thing. About 6 years ago, we tried the same thing going into the disc, but it's really complicated. It adds a lot of risk and a lot of cost, and it never produced better results because when you go into the disc, you have to do it with fluoroscopy, which are specialized x-rays in real time with a spinal specialist in the OR under a fentanyl twilight sedation because you're on your stomach, you can't be fully asleep. And then they go in, it looks like you're harpooning a whale. It's this huge rod, they guide it in and do it. And you'd think that would then get into the disc and rehydrate and fix it. But you know, we were wrong. And it seems like a lot of these other places are wrong too, because that's not how the stem cells work. Mesenchymal stem cells are actually, they should be called medicinal signaling cells. That's what Dr. Kaplan originally named them, wished he could have renamed it, because they aren't really a stem cell in the body. They're not going to turn into new disc cells. They're not going to turn into the cells you want them to. They work via the paracrine effect, meaning the signals they send out do the work. So they're the manager on the construction site. They're guiding the repair process by telling everyone what to do. And as we all know, when you're fixing something, you want good management. If you just let the workers go and do it, they'll just keep working forever, usually won't fix it or won't do it properly. With good management, you'll get it done perfect in the right way, and it's the same thing in the body. So by injecting the cells around the most affected area, they can do a few really crucial things. So for sciatica and just herniated discs, which is usually the root cause, they will help rehydrate those discs. So at night, when you go to bed, you lay down, you take all of gravity off of your back, you relieve that pressure, and the back can decompress. You actually technically wake up taller in the morning than when you went to bed because all that pressure has been relieved and the disc can rehydrate and the spine can expand. So that's when the back can heal. But if you don't have the proper management, it typically doesn't happen. And that's why we help so many people with back pain, because over time, not rehydrating those discs, not fixing the issues adds up. And as we get older, we have fewer and fewer of these types of stem cells to help guide that process. So by getting in there, they will then help rehydrate those discs. In fact, if you go to our website at www.dreambody.clinic, scroll down on the homepage, find the lower back treatment, excuse me, you will see a really good video by Dr. Yoni Witten where we more than doubled his disc height at L5-S1. And he goes to an even more depth of this, so you can watch that. But that's what we do there, rehydrate those discs. So imagine an ice cream sandwich. That's your back right now. It's being squished, and that disc is herniating out, being squished out, pushing on the spinal cord. So as it rehydrates, we're filling it back up, getting it to its normal size and shape, and it's not squishing out of that zone between the vertebrae. It takes the pressure off the spine. So that's how we're able to help sciatica, help guide that repair process, but the stem cells will get to work even sooner than that. So 4 years ago, I had sciatica. I had a herniated disc at L4, L5, and it was pushing on the root of the nerves or at my spinal cord and causing massive pain. It felt like someone had a cattle rod to my femur. It was the worst thing I've ever dealt with. Didn't sleep for like a month, thought it would go away, tried to tough it out, it just didn't. So finally I did the MRI, saw what was going on, and fortunately we have a protocol for that. So I did it, 4 shots of 25 million, my lower back, 100 million IV. I did everything wrong. You're supposed to rest and relax for up to 6 weeks post-treatment, let the cells focus on the most affected area, you know, without causing inflammation so it can hone in. Well, That's what you should do, and then get back to exercising. I didn't. I had a trip to Peru lined up. I flew to Peru the next day. I spent 2 weeks in the Andes climbing mountains, carrying my son up like ancient ruins. One of the toughest back workouts of my life, and it still healed. Within 10 days post-treatment, all my sciatica was gone. So we know it hadn't rehydrated the disc that quick. That's too quick. It typically takes 3 to 6 months to rehydrate a disc or to fix cartilage in the facet joints or damage in the back. All of things that stem cells can do, but it takes time. So it took about 3 months for my lower back pain and tightness in the hips to go away, but the sciatica, 10 days. And that's because the stem cells send out a lot of what are called neurotrophic factors. These will guide the neurons to regenerate the nerves and get them feeling good. So in my case, it sort of rerouted those nerves around the impingement in the spinal cord, which then got rid of the pain. So I was pain-free, at least with sciatica, which was the worst part of it, within 10 days. The lower back pain and tightness took about 3 months, because that's how long it took to really, rehydrate the disc, start fixing up other issues. So we see a lot of things. We'll see some people, stenosis means the disc height has been shortened. That's usually caused also by herniated discs. Sometimes it's just from dehydrating discs or damage. It's a bit tougher, but we can help at least stop that and slow it down. If it's being caused by a herniated disc, we usually can fix it because we still got all the discs left to get it back to normal size and shape. Then you've got the facet joints where arthritis can fill in, and that's the root of the nerves coming out. The cartilage inside starts to break down, pinches the nerves. That can also lead to sciatica and other issues. So we can build that back, fix the nerves, get you pain-free. It's been working incredibly well. If you go to our website, you can see so many testimonials of people we've helped with back pain, and it's more common in our society. Most people go to their desk, they're sitting down like I am now, typing away, working, and that's not good for the back. You should not be sitting down for that long all day. But what do we do? In this modern society, that's typically a requirement for most jobs. So you got to do things. Some of the natural things you can do to at least slow it down or even prevent it is the best. Hang from a pull-up bar. That relieves the stress, can open up the back. It's one of the best things you can do for your back. And it's tough. You'd be surprised after about a minute how tough it is to even hold your own body weight. Especially me, I'm 6'2", about 245 pounds. It's a lot of weight to hold there. And it doesn't seem tough because it's not like you're doing a pull-up, you're just holding, but it starts to wear on you, but it really decompresses the back. So one of the best things you can do in that regard, because it also engages the muscles. There's also these machines inversion tables where you lay upside down, and that does relieve the pressure on the back, but it doesn't engage the muscles, so it tends to be not as effective. So just hang from a pull-up bar. That's a good thing to do, but that's preventative, or that's something to do after you've fixed your back with something like this stem cell therapy. So that's what we recommend. I also recommend people look into the supplement undenatured type 2 collagen. Again, that same guy that I had recommended, Dr. Yoni, he has a brand, painfreeprotocol.com, and this is his joint relief. That's got some undenatured type 2 collagen in it. I'm a big fan. I take it. And my real outliers, people with massive issues, majorly herniated discs, really bad cartilage wear out in knees, shoulders, when they take that type of supplement, whether it's Yoni's brand or another, that's where I've seen my outliers that get the best results. So there's some tips for you. If you've got questions about the back, we're happy to help anytime. You can also send in any recent MRIs you have. We'll take a look at them and let you know if it's something we can fix, because there are certain things we can't fix. And we're very straightforward with people about what we can and cannot do, because bad news travels faster than good. We don't want to treat someone we don't think we can help, because then they're going to go tell everyone stem cells don't work. And that might be the case in their situation, but for most people it's not. So we want those success stories. We want to treat people we think we have a very high chance of healing. And you can do that by simple analysis. In fact, we include and require an MRI with any of our joint treatments, including this. We would do an MRI of your lower back. We have our own open MRI machine on site, which is nice because I get claustrophobic when they put you in the big tube and make you lay there for 45 minutes. It's not fun. With ours, it's more like a big C-arm. You just sit in there, you rest, you relax, take a little nap if you can handle the noise, and get it done. So then with that, we sit with the patients. Our doctor goes over the images, shows it, explains it. It's not like the US. Doctor's not just gonna be like, oh yeah, we can fix you. Oh no, we can't. No, our doctor's gonna show you and explain it so you understand. You know, this is a very in-depth process. Our doctors do a great job of showing how they can help, and we'd love to help you. So you can check out the website at www.dreambody.clinic. Scroll down on the homepage, click on the lower back treatment. All the info's there, the price is there, links to studies, patient testimonials, it's all there. Or you can call us toll free at 888-704-3977. I'm Josh, happy to help.